The member for Higgins.
Thank you, Mr Speaker. My question is to the Minister for Health. Will the Minister please update the House on how the Morrison Government is guaranteeing the essential services that Australians rely on through the provision of increased access to vital mental health services and support?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to thank the member for Higgins, who, as a nationally leading paediatric researcher, understands essential services and understands in particular that the provision of mental health is one of the most essential of services that Australia can provide. In particular, in any one year we know that mental health is a challenge for all of us in all of our electorates. 4 million Australians have some form of mental health challenge. This year, of course, it has been harder than at any time since the Second World War. We have seen in the 4 weeks just finished a 31% increase in Medicare mental health services in one state alone, in Victoria. We've seen a national increase of 14%, and outside of Victoria that national average was balanced out by an 8% increase in New South Wales and 7% average across the other 6 states. So what we can see is that there is a profound impact across the country, but in particular in Victoria at roughly 4 times the rate of growth of other states. And that's a significant and undeniable consequence that we all have to address and recognise and respond to. At the same time, when we look at the comparison of Kids Helpline, we see a 31% increase in Kids Helpline services in Victoria as opposed to other states and territories, and a 77% increase in Beyond Blue services in Victoria as opposed to the rest of the country. So against that basis, what we've done is we've invested $5.7 billion in the budget, an increase of $500 million in mental health services to help meet these needs, to support these needs, to add to the capacity that's available. Telehealth in particular has been made available with now well over 35 million services, of which we see that mental health is a very major component. In addition to that, what we've also seen is, beyond telehealth, the addition of $100 million for doubling the Medicare Better Access services in Australia for psychological support. And then in Victoria, where there's an additional need, there's $44 million which has been put over and above everything else. And that includes $17 million for services such as Beyond Blue and Kids Helpline, to provide that support, to provide that belief that we can get through this most difficult of lockdowns in that state. And what we see as well is that we've set up and we're operating 15 new head-to-help clinics in Victoria, set up over a period of 3 weeks. All of these things are helping to protect and support the mental health of Australians.
Has concluded.